As Sally said, a very warm welcome to everybody, and this is our third session of our New Look Happy Hour series this spring. And it's great to have a real stellar cast of presenters. And as Sally said, we are going to be looking up at the levelling up agenda, and it does feel that over the last 2 or 3 months we've had a series of white papers where issues around levelling up, integration of health and social care, and putting the spotlight in housing with an adult social care focus has all started to percolate up. And this session is going to explore some of that. And as the slide shows, our agenda will draw attention to work across local government and the housing association social housing sector. And we're joined by Chris Hampson, who's the Chief Exec of Look Ahead. He's going to reflect on some things will have to change before housing associations start investing in housing again, supported housing again. And this very much picks up on a recent blog he wrote and an article he wrote for Inside Housing. Jill Quinton, who's a really great member of the ADAS Housing Policy Group, and also a champion of adult social care, but also working across housing and health. And she's going to talk about her experiences at Buckinghamshire Council as the Corporate Director of Adult Health and Housing. Frances, thanks very much for joining us this afternoon too. Frances Burrows, Director of Support and Service Development at Orbit. And Frances recently wrote a blog for us about moving on from the pandemic. And this follows a presentation he gave at the Housing Quality Network conference. And last but no means least, a great supporter of the LIN Anchor, and Anna Clulo, who's going to talk about health and well-being and the perspectives of that from a resident's perspective and the work of Anchor Later Life programme. So without further ado, I'm going to hand over to Chris, who's going to kick off this session. So Chris, over to you.
Thanks, Jeremy, and good afternoon, everybody. I hope my connection stays with us, but they're going to let me know if I have any problems. It's a pleasure to talk on this subject of supported housing and the need for housing associations to get involved, because I think it's very topical and there's a lot going on at the moment. Just introduce myself. I'm Chief Executive of Look Ahead Care and Support, Look Ahead Housing and Care and Support, and we are a housing association. And we operate across London and the southeast, and we've been in that space doing support and care. We're very niche. All our housing is used for care and support, but we've been around for nearly 50 years now, and we have about 120 odd services, and we work across 4 main client groups, and that's mental health, learning disabilities, young people, and homelessness and rough sleeping. We don't do older people services, but we are increasingly doing niche older people services with older people with learning disabilities, older people with mental health needs. And interestingly, with rough sleepers, we're looking at working with older rough sleepers in end-of-life services and connecting them with adult social care packages, which I think is quite interesting. So we're very much in the older space, but it's niche. And we work with about 39 different local authorities, but increasingly we're working with health. In the last 5 years, I think health trusts and CCGs have become almost equal in terms of the amount of revenue funding we get to run services. So the landscape's changing quite dramatically at the moment. What I will say, just before I talk about some of the issues, it's an interesting time, because I think there's more demand now for supported housing perhaps than I can remember for many, many, many years. And the pandemic has thrown a light on that. We're increasingly being approached by mental health trusts to work in the space, to move for people stepping out of hospital, to provide more community-based supported housing, and to help free up bed spaces. And there's a lot of interest in housing associations operating. And that happens just right at a time when I think we've got some of our biggest challenges in terms of the lack of supply of supported housing, which is a real shame. I think without doubt, the number of, I haven't seen any figures lately, but I think the amount of supported housing we have across England, certainly, is probably a lot less than we had 10 years ago. And there's a number of reasons for that. Housing associations are one of the major scaled up players in supported housing. They've got the ability, they're developing associations, but they have been exiting in quite large numbers over the last few years. I think it was probably triggered for many of those who remember the old supporting people pot was probably the starting gun for that. But a number of other things have conspired to make it a very difficult space, and one they don't frankly want to, many of them don't want to operate in. And I think this is what needs to change. I mean, housing associations have a number of priorities, not least the government's put a lot of pressure on them to deliver more social housing, general needs social housing. But I think certainly since the Grenfell fire, there's been a lot of call on their capital expenditure programs for having to make sure that they deal with all the cladding issues and all the fire safety, which is huge. And we've also got the climate change carbon neutral agenda, which is requiring a lot of capital expenditure from housing associations. So if you were to talk to associations, many of them would say to you, why would I do supported housing? It doesn't stack up financially. It's a very risky sort of business, and we've got a lot of other priorities. And one of the real problems, I think, is we're seeing, particularly in the last 5 or 6 years, is some of the stock that's been traditionally used by large housing associations has actually been sold up. And the capital receipts for those are put into their mainstream development programs. So I really think we have to look about how we reverse that trend. And the other issue is, even those old buildings that are still in the sector, I think there's a huge lack of investment in those buildings. And a lot of those old supported housing buildings are not the sort of psychologically informed environments we want for supported housing. They're not what commissioners, whether they be health commissioners or local authority commissioners, need for some of the more boutique, more modern services, smaller often services that they need for the client groups, whether it be mental health, learning disability, young people, or whatever it may be, or rough sleepers. We certainly find that. So it needs a lot of investment in buildings. The other issue is it's just a lack of other providers. If housing associations are not the mainstream suppliers of future supported housing, who else is? And it's interesting, the other major player, of course, is the private sector. And we work very closely with parts of the private sector, but the private sector only fills a certain space in supported housing. We often see the private sector in the high acuity health space doing inpatient services. We see them very much in parts of the registered care space, particularly learning disabilities, and less so in mental health. But it's interesting where they operate in the learning disabilities space. They're clever, they're very clever. They do provide some quite good services, but they do not do anything that's going to be too difficult. They have to make a profit. And it's interesting, looking at it in the last few years, has done quite a lot in the transforming care space with learning disabilities. But this is not an area, and we do develop, we've bought purchase buildings, development buildings, and refurbished buildings for this. But we know that the transitional arrangements for someone stepping out of hospital could take 6 to 9 months before they're ready to take up accommodation. And yes, the packages are quite high with the people that come from hospital into the space, but it's very slow to fill up. And then placements can fail, and there's a lot of challenges around that. So this is not something, and I've spoken to private sector people in this area, it's not an area they want to go into. And this also is very much for the outer area placements in mental health, step down, many of the crisis and recovery services that we provide, for example, and others like us, the higher acuity mental health supported living schemes. It's not somewhere the private sector goes. They tend to be in the more in the inpatient space, but they don't go into that space. So we don't get housing associations involved, and we don't manage to bring them back into the space. I mean, the mainstream ones, organisations like Look Here can only do so much in this space. We won't get the scaled up supported housing that's needed across the country. And one of the biggest disincentives, and I want to throw it out there for some of you that might understand this, for associations entering this space, apart from the ones I've already mentioned, is the lack of capital grant. There is a grant system at the moment, and the funder of that is Homes for England, and it's antiquated, to say the least. Basically, it works so you get a capital subsidy that makes up the difference between being able to charge a social rent and the price it costs to buy the land and build a building, and it just doesn't work. And I think there needs to be pressure on Homes for England. There needs to be an understanding across the sector that they really want to generate more spend, and they really want to get that money, more take-up of that money. They're going to have to look at those grant rates. I was on a meeting just yesterday with Homes for England. It was very interesting. The guy who was representing them, he said that we use 10% of the total affordable housing pot is allocated for supported housing. And he said the take-up of that is very low. He said that alone would generate 13,000 units nationwide, and yet we can't spend the program. So therein lies a big problem, I think, that we need to address. Grant levels is a huge issue. I think there's also real risks associated with moving into supported housing that many associations don't understand. So what are the solutions? I just want to chuck a few things out there to think about. I just think there's a huge, massive vacuum, a strategic vacuum for supported housing. We don't, for example, have a national supported housing strategy, and homes, we're trying to sort of lobby, get Homes for England to have a supported housing strategy about how they need to spend that money. But I don't think it's a case of just Homes for England sitting around with a few associations now and delivering and writing a national supported housing strategy. Supported housing is very different to general needs housing. It's become quite integrated into the adult social care and health space. I think we need a national strategy, and it needs to be co-designed and co-written with NHS England and with local government, the local government associations, who are the other big players, about setting the strategic framework, if you like, for that. And why I think it's a particularly good time to have a national strategy is we've got some interesting structural changes happening at a local level. And I'm talking here particularly about the integrated care partnerships and the new health structures. Yes, I think in the first year or two, they will be heavily focused on acute housing health services, but they are a great space, or potential space in some of the structures that will sit below them, because they will have local government involved and other key community stakeholders to start to think about, within the context of a national supported housing strategy, to have local supported housing strategies. And I think once you start to get it done at a strategic level, at the place level, if you like, starting to think about what is already existing, what existing provision is there, is that right, do we need to, what needs to be modernised, what numbers do we need, we start to get the building, or the foundations, if you like, of a proper supported housing pathway. Of all the areas we operate in, I can only think of one area that we operate in East London where there is actually a proper integrated pathway, and that's in the mental health space mainly, where you've got people, a proper pathway from someone leaving hospital to stepping down into a crisis service, to having registered care services, to having independent supported living, lots of different variations of that, short and longer term stay, and outreach and floating support for people that are ready to go back into the community, for those that are, and that's joined up and is properly owned by health, adult social care, and the housing providers that are involved in that space. It's almost unheard of, and I know I hear of other versions up in Manchester and other places where that works. But we need to move from this position where it just happens by chance, or it happens because of enlightened clinicians and local government and health working together. It needs to be put on some sort of strategic footing. So my big ask, and I think the timing is really, really good for something like that to happen. And as I say, I think there's a real appetite for supported housing providers. And it's very interesting. I've been in supported housing for a long, long time now. And I think there are providers look at some national providers, not just regional providers, who have developed infrastructures in their organisation to manage serious incidents, to manage safeguarding. They have governance arrangements that can work with very high acuity people or service users in this space, that mirrors and gives the confidence to the health sector and to adult social care that we can work with very complex client groups. And it's a shame. I think if that could be scaled up and there was more of an appetite to engage in that, I think that integration between health, adult social care, and health would be really, I think we could go a long way. So, Jeremy, I'm not going to say a lot more there. I think the big call there is, I think we have to come together with health, local government and housing and push for this national strategy. It's a great time. Never have we seen, we've gone from a period of having not much activity nationwide to having the integration piece of legislation for health. We've got the adult social care piece now, and that's got some really interesting stuff in about the 300 million to generate local partnerships, and therein lies another conduit, if you like. And then we've got the levelling up agenda now, which is also talking about, and I think having local supported housing strategies is a core part of that. So enough from me. I'll be open to questions later, but I just want to, I'll leave it there.
Chris, thanks ever so for that introduction. And I think what you're really saying is that vision has to be a new deal for supported housing in communities. And it's also a great segue to our next speaker, Jill, Corporate Director at Buckinghamshire, because I know she's very much thinking about where does supported housing, older people's housing fit into that local economy, both from a housing perspective, but also that relationship with adult social care and health that you touched on as well. And I think the evidence that you and the organisation organisation have showed through your work around mental health, psychologically informed environments, homelessness, really is testament to building that evidence base about why it's critical that those partnerships are in place. So thanks ever so much for that intro section, and really looking forward to hearing from Jill. So Jill, I think you're going to share your screen, so over to you.
Thank you very much, Jeremy, for the introduction there, and I hope that everybody can now see the screen in front of them. It's great to be here this afternoon and to get the opportunity to speak with you all. I'm going to cover a number of the white papers that have been published just recently, and there have been a number of them. There's been the long-awaited Levelling Up white paper, and the even longer awaited social care reform papers, and there have been 3 of those. So we've been inundated a little bit after waiting many, many years, suddenly to be inundated with white papers. And then I'm going to finally finish with what I see as the opportunities and some of the risks contained within the new approach from government. And of course, this is a really short session, so it's going to be very high level. So please, if there are any questions of detail, pop those in the Q&A bar and I'll pick those up later. But just to kick off then with the Levelling Up white paper, and it really gives us a great context, I think, for addressing some of the wider determinants of health and health inequalities across the UK. There are 12 missions within the white paper, and in particular, I think a number of them, life expectancy, perceived well-being, reduction in crime, skills, pride of place, all have really, really strong synergies to both housing and health. But there are a number of concerns that I've got in particular about the white paper, not least of which is the concern that it signals quite a shift in funding from the relatively prosperous south to the north of England. Now, coming from Buckinghamshire, you would expect me to say that, but some of the biggest health inequalities gaps exist in the southeast of England. So within Buckinghamshire, the life expectancy of our residents varies by 10 years, depending on which part of Buckinghamshire you come from. And in Buckinghamshire, one of our wards has over 20% of residents on universal credit. Now, if you compare that with, say, Durham in the northeast of England, their resident rate on universal credit is 15%. And you probably wouldn't expect that in what is perceived to be a very affluent, leafy green, rural part of England. But there are significant health inequalities that are hidden within some of those communities. So, you know, the whole Levelling Up agenda has to, in my view, have a much more granular and local approach to it if it's really going to address some of those disparities that exist in our communities. So there are, of course, some real crossovers between Levelling Up and some of the health and social care reforms, particularly in relation to prevention and wider determinants of health. So if we start to look at some of the health and care white papers, and there have been, as I said earlier, 3 of those, working together to improve health and social care, which was launched in September last year. We've also had People at the Heart of Care, which was launched in December last year, and then the Integration White Paper, which was published this year. Now, both the social care reforms make a number of notable pledges within them, but I want to highlight the most significant for me, which is really the underpinning value about enabling people to live in their own homes. And that sounds really simple, but as we know, many people are not enabled to do that. There will, as part of the reforms, be significant investment to enable that to happen. So there's going to be a lot more money flowing into DFG, disabled facilities grants via the Better Care funds. There's going to be a new scheme, a new type of handy person scheme to help invest in people being able to improve their homes and make improvements at a more local level. But as we all know, the real prize is the development of lifelong homes and multi-generational communities, and that's the space that we really need to get into. But I want to point out one really significant issue contained within all the social care white papers, and that's around the investment that is planned. So we know that there's going to be an increase in national insurance in April this year, 1.5%. That will generate £12 billion of revenue nationally. So over 3 years, that's going to be 36 billion. Now, over that 3-year period, only 5.4 billion of that money is going into social care out of 36 billion. The rest is going to health, to try and address some of the backlogs in health. So immediately you can start to see that there's a massive disparity. And one part of the system, the health system, will not operate effectively if the social care system is not fully enabled. And in social care, I'm also embracing the wider context of lifelong living, people in their own homes, people enabled to live independently, and the impact that housing has. Now, what really is needed to address all the issues within social care, according to the LGA, is about £40 billion, and we're getting 5.4. So as you can see, there's going to be a lot of discussion about whether there is sufficient money to enable us to do the things that we're going to be required to do. And then finally, 2 weeks ago, we received the integration white paper, which gives integrated care boards a specific role in helping to join up health, care and housing. So if you've not noticed that, I would recommend that you read the integration white paper, because the integrated care boards are going to be really influential if we get those right. But I think it's important that housing and our partners across housing are really involved in the development of those boards as well. Now, the integration white paper has similar themes around prevention and levelling up and joining services up for the benefit of the patient and the residents. So they're all saying really, really good things. Now, what does this mean for us? What are the opportunities that we get from the new approach from government? Well, there are a number of opportunities that I think will help create a more joined up approach to housing, health and care. Prevention is notoriously difficult, isn't it, to get investment in. The payback times are often quite lengthy, and in local government in particular, members are quite short term, I think. They want to be able to demonstrate to their local residents the impact that their term of office has had. So it's really difficult to persuade members to significantly invest in something when the payback might not be really demonstrable until, say, 5-10 years further downstream. So that's a real issue for us, I think, how to really get both housing, health, local government, social care to invest in real prevention work that will have an impact. And one of the most significant tools in our prevention box, in my view, is housing, and the impact that can have on people's lives. So that's an area that certainly within my authority I will be working really hard to get significant investment in. An explicit role for ICSs in helping to ensure that ICSs integrate housing, health and social care, I think is a new opportunity for us as well, about really getting housing very much on the strategic agenda, particularly with health. So I think that's something to be grasped and welcomed. The Home First mantra within all the white papers as well, I think is a fantastic opportunity for us to focus on lifelong housing, or accessible housing as I like to call it. I think that's a more all-embracing term for different types of housing that will last on a person's lifetime journey. So I think that Home First mantra is really very much to be welcomed. Within the funding for the white papers, there's going to be a new innovation fund. And again, I think this presents us with some great opportunities to demonstrate to government the innovation that we can bring about through joining up health, social care and housing, and possibly to get some inward investment on the back of that as well. So definitely that's worth talking to partners about and trying to develop some initiatives around. Now, I also predict a resurgence in interest in housing from various sources on the back of these reforms. So I think, again, it's an opportunity for us to really grasp that and to work in partnership to really identify what the genuine needs are for our population out there and how we can address those through better investment in our services. But having said all that, it isn't all sunshine and rainbows, I'm afraid. I think that, I'm really sorry to bring us back down to reality here with this slide, but we also need to be realistic about the massive challenge that's ahead of us within the public sector. Our COVID backlog, both in local government and health, is significant. Now, in my organisation, I've got well over 1,000 people waiting at the moment for social care assessments, and that's the highest backlog that I've ever had. So, our focus is absolutely on getting that backlog down. So that means our capacity is limited to deal with all the new initiatives that are hitting us on a regular basis. The timescales for all these changes are incredibly tight. One of the most significant for me is that we have to, within social care, complete something called a cost of care exercise, which is really about regulating the price we pay for care out in the market, and this will impact on all providers. And that exercise has to be completed along with a market capacity analysis by September. They've got to be submitted to the Department of Health and Care by September. The guidance on how to do that is not going to be published until March by the Department for Health and Social Care, and the toolkit by the LGA is going to be published in April. It takes at least 3 to 4 months to complete a cost of care exercise in consultation with all the providers, and that's a really short time frame. So you can work it out. There's definitely not going to be enough time to do all this work and then to go on to do the market capacity assessment by September. So there is a lot of lobbying nationally at the moment to get these timescales shifted, and we'll have to wait and see whether that has any impact. We also need to find ways of joining up services. I've said it, a number of times in this presentation about how we need to integrate healthcare and housing, but we do need to look at how can we undo years of culture change that have created the silos that exist around those three services, and that's not going to be an easy fix. That has to be worked on and will take some time to do. So I've talked about the long payback on prevention and the wider determinants of health as well. I think that's a really big challenge for us. And then finally, skills and resources. We've already had an example of how the money available for social care is going to be nowhere near enough to meet the challenges that we have ahead of us. The capacity we've got at the moment is focused very much on the backlog. So how do we create that space and capacity to move on to look at some of these more exciting things? I shall leave you, I think, at that point with those conundrums, and it'll be interesting to pick up your thoughts and comments on those at the end of the presentation. Thank you, Jeremy.
Thanks, Jill, and thanks very much for giving such a rapid overview, but also picking out the real salient points around integration, but also the importance about how that impacts not just for users of services, but all the workforce as well. That's something we need to remember. Hidden away in the Levelling Up white paper, also following on from Chris's presentation, is a small reference to a task force looking at housing for older people, and we very much look forward to hearing from DLUC on that, what the terms of references on that, and hopefully we can touch on that later. But I'm going to quickly move on to Francis and Francis Burrows at Orbit. Francis, as I said earlier in my introduction, you very generously wrote a blog for us, and it picks up on some of the work you're doing very much on the ground. And I think it follows neatly from both Chris and Jill's presentation. So over to you.
Okay, thank you very much, Jeremy. And so good afternoon, everybody. And for those of you, just for a bit of background, I'm the Director of Support and Service Development for Orbit. So we've got about 45,000 homes across 108 local authority areas. So we start from sort of Warwickshire in the west over to Norfolk in the east, and then all the way down to the south coast. And of those homes, about 5,500 of those sit within my portfolio. So the majority are housing for older people. We've also got about 765 homes which are part of our supported housing portfolio as well. So there was an awful lot that Chris spoke about earlier that really resonated with me around the need for a really sort of clear strategic vision for supported housing, making sure that we do have the right funding. And I'd say that there is also a lot more work needed in terms of housing for older people. So if you cast your mind back to this time 2 years ago, as we're all seeing images on the news of this strange disease in China and people being dragged out of their apartments, things, and then suddenly, a couple of weeks later, we all got confined to our homes as well. And that led to a very sudden, very rapid change in the way that we all had to respond and the way that we all had to provide services. And I think it's always useful to be able to reflect and look back and see, what have we learned from those? And actually, what's the opportunity? What can we do differently going forward based on this experience over the last couple of years? Because certainly we had a major shift in operations overnight. We stopped traveling around all over the country, which again had big impacts on the environment, but also changed the relationships that we had with each other as in the staff team, but also with all of the people who live in our homes as well. And it made us think differently around how we engage with our customers and what else do we need to do to provide the right services and the right homes in the right place, because we know the need is out there. So one of the key things that we did to start off with was actually talk to people. So we identified that we've got about sort of 6,000 older people living within our older people's housing, but there was a further 11,000 people over the age of 65 within our general needs properties. And that's where we don't know a huge amount about them, and we didn't offer any dedicated service or anything particular. So one of the biggest areas of work, instead of thinking about all the usual sort of housing management and things that go on, was actually getting on the phone and talking to these people and actually finding out how they were. Was there anything that was needed? What was their experience like? And just taking the time to sit down and talk to them, which for some cases could be for a couple of minutes, but for some cases actually could be a couple of hours, because there's a lot that actually we could unpick and really help those people. And that's given us such valuable insight and understanding into what they've been facing and how can we then really transform the service that we provide. So we had a number of people who did need support because they couldn't get food, they couldn't get medicine, so they needed to go to food banks, but also we could then tap into all of our other support services. So we have a program called Better Days, and that enabled people to, through that, access counselling services. It helped them to access benefit support and a range of different interventions so that they could stay safe and could stay within their homes, particularly those people who are really struggling with isolation. And all of those conversations, apart from just giving us a much better insight, and actually know that those people were really happy that we contacted them and actually did feel like we cared, but actually that we can also now think about the kinds of services that we can provide for those people. So one of the biggest changes that we've now putting into place is, previously we had a budget for aids and adaptations, and people would say that they would need a grab rail and they'd had an OT referral, and we were trundling along, install a grab rail, great, but so what's the actual impact for those people? Is that the right thing for them? Or what other conversations should we be having with them, and providing a much broader service offer? So in addition to the installation of the grab rail, we are also now able to talk to people about what their options are and actually do that kind of work to understand, do they want to stay in that home? And if so, what else is going to enable them to stay there for the next 5 years, 10 years permanently? Or is it also the time to think about what a move might look like as well, and see what kind of other support is available? So whether there's some local sheltered housing, extra care housing available, and how to help people to actually identify what that would look like and talk them through that process about how to move, and take out some of the sort of the mystery around these strange buildings that are out there that no one really seems to know what there is that's about. And there was a survey that we did about 2 years ago now, to ask people about their understanding around what is retirement housing, and there was a whole range of very disparate views, and a lot of people saying, well, it's a care home, or oh, I don't really know what that is, or that's just for the old people, it's not for me as well. So there's a huge amount of work that I think we can do to come out of this in terms of how do we challenge people's preconceived ideas around what these communities and what these environments are going to be like. Because I think one thing that really has struck me is about the very low numbers of COVID rates that we've actually had within these schemes. So within the sheltered and extra care housing, we've had lower rates of COVID than within general needs properties. and we've been able to keep people safe. We took some quite strong measures at the start, and as things have progressed and as we've learned more about COVID, we've been able to tweak some of those things, but working very clearly and communicating with customers to understand what they want and what they don't want, and how do we get that right balance between keeping people safe but also understanding what their well-being is happening as well, because that issue around isolation is so critical. And where you've got people living in a one-bedroom apartment and if they don't have their own balcony or their own garden space, again, not having access to communal facilities was a real barrier to them and had a real impact. So it really has been about keeping people safe, but also how do we think about that more holistic range of needs for them, as we can then start to open up and introduce more in terms of activities, different kinds of support services, and then bringing in those sort of range of external partners as well to be able to help people. And that's why we've maintained our staff presence on site, and we restructured some of the staff team during the pandemic to increase the amount of time that staff are spending on site. And there is a dedicated scheme officer for every scheme. And that's really helped to build those relationships and also helped us deliver a new customer engagement approach as well, so that we're spending more time listening to people and having the right quality of conversation, so that it's not just, oh, how are you, but actually, how is this scheme working for you? How do you find your home? What else is there? Are we providing the right services? What else can we be doing? And how can we listen more effectively and understanding people's frustrations if the repair service hasn't been so good, and actually having a sensible conversation and explaining what's going on within the supply chain. I think historically, it's not something housing associations have always been as good at as we could have been, and particularly from our perspective as a large national organisation, sometimes it's about how do we overcome that challenge of being a bit faceless occasionally, and actually really building those personal connections with those customers. And what I've done over the last year is I've been out to every single scheme, and I've spent sort of a day or half a day in each one of those, and just basing myself there and talking to people, attending the scheme meetings, but also just having those one-to-one chats and really sort of understanding what people's experiences of the service have been like. And sometimes it's been great and they've been really enthusiastic. Other times they've had quite a lot more to say, and rightfully so in some cases. So understanding and giving people the opportunity to say, you know what, if something's been awful, tell me about it. And I'm really sorry if that's the case, but this is what we can then do, and how can we learn from that, rather than just allowing things to go on. So I think that's different types of engagement and encouraging people from other teams as well. So it's not just my team going out, but also getting people from the repairs team to go out and actually talk to customers, or getting people from tenancy sustainment to go out, so that all of those people have those relationships. And so we can get and then think about how else do we improve, and what else is it that we can provide. So we've installed at 27 schemes now the new digital warden call system. So again, that's had an absolutely transformational approach to a number of people who previously had never used any kind of sort of tablet or mobile device. And now, after sort of once they've started to use it for a while, they've been using not just the system to call through to the monitoring centre, but actually they're using it to contact their friends in other apartments within the building. So even during periods of isolation, they've still been able to do those video calls and maintain those relationships and friendships that otherwise they just wouldn't have been able to do. We're working with the University of Sussex on a project at the moment where we're using 3 of the schemes where we've got the call system installed and testing out different types of assistive technology. So as well as the warden call system, we can put in different types of room sensors, wearable tech, Internet of Things devices, to really understand how people use their properties and what else can we do to try and enable people to stay in the home that they love, particularly for those people if they're at that closer end of needing to move into residential care. And then otherwise, the other things that come out of this around how do we improve the integration with health and social care services. So there was an awful lot that Jill said that resonated very strongly with that. So we've allocated more of the apartments within the extra care schemes as step-down beds to improve that flow out of hospital, so that people can then stay within that the extra care scheme. They've got access to the 24-hour care service while other work might be done to their property, or they're finding alternative accommodation. So a much better environment for those people to be in, where they can still access a range of facilities and a range of services and that social life, rather than being in hospital as well. So that's definitely something else that we can do more of. And the other thing that has really sort of been absolutely critical for me is about the investment and the transformation of the portfolio as a whole. So we've got a number of sort of 1970s built sheltered schemes where they need more investment. We've had the same issue that most housing associations have had about how do we invest in these things, or what else does it look like? So the plan that we've got is quite radical, and it's about how do we really transform all of those properties that we've got. So we've got competing agendas around net zero carbon and retrofit. We've got the development team saying, well, it's going to be expensive, not so sure if we want to do all of that, but actually strategically said what's really important is providing the right kind of homes for older people. It has the benefit for that sort of throughput from freeing up the larger general needs property as people downsize or right size, but also showing people that they can have a long-term home in later life that does meet their needs, that is modern, is comfortable, but has that range of support services, whether it's through assistive technology, on-site care teams and the other facilities around that. So part of the big piece of work that I'm doing is about putting together a really comprehensive business case for investment in new schemes, and also investment in redevelopment of some of the older ones to bring them up to the standards that people expect, because they are already integral parts of the community and people know them and they really love them and really value the support that's available. So the next step really is about that growth and how we can also shout about it and also work together much more effectively as a sector to say, you know, these are hugely important buildings. They're really integral aspects of a good functioning society, so that we can provide the breadth of accommodation to meet the varied needs of people. And only by doing that will we be successful. And then we can link it in with all of the other services that are going on within local areas, because there's some great things that we can provide, but also there's a fantastic voluntary and community sector in every area of the country as well. And how do we integrate with them and linking in with the health, with the social care services, so that we can be real hubs within the community and provide really good integrated services for older people. So I hope that's given you a good overview about some of the things that we've done over the last 2 years. I will be sending out the slides to the HousingLIN team afterwards as well, so you'll see a lot of the notes from those. But again, very happy to have a conversation with anybody about anything that we've gone through as well and share that experience as well.
Francis, thank you very much. And I know Sally posted your blog early on in your presentation just now, but what struck me really is sort of different aspects of levelling up. You talked about sort of like levelling up in terms of digital inclusion. You talked about levelling up in terms of improving the design quality. You talked about issues around levelling up in terms of your service offer, so that's a better offer for customers. But what really struck me was that stakeholder engagement and your own personal experience, and also organisational experience of really engaging with residents. So thanks very much for your insights and sharing your work with us this afternoon. I hope we can sort of generate further discussion in the Q&A shortly. Well, I'm going to ask Anna Clulo, thanks very much. And I hope that sort of you're not last but no means least, because I think what Francis was sort of talking about was very much around better understanding the health and well-being of Orbit's residents. And of course, that's so central to the work that you do. So we look forward to hearing from you about the work of Anchor in terms of your experiences around enabling residents to have better outcomes and tackling some of those health inequalities that Jill also touched on earlier. So you've got your slides up and I'll pass over to you.
Thank you. Thanks, Jeremy. And yeah, I think we're neatly segueing in from what Francis has been talking about there. Thanks for joining us again today. I'm going to make sure that I try and keep this punctual, as I know that we're keen to get onto the Q&A. I'm Anna Clulo, and I am the Resident Involvement and Wellbeing Manager for Anchor, who are the UK's largest provider of homes for older people. So I'm just going to whiz through, and it may be a quick whiz through some of these slides today to talk you through our journey in terms of well-being, from really how COVID has impacted and helped us develop our wellbeing offer for our residents at Anchor. So wellbeing came over to my team, which was previously just involvement. So there's no real home for wellbeing until post-pandemic, really. So in terms of sort of the height of everything from 2020, so back end of 2021, wellbeing came over and now sits sort of neatly in the involvement team along as part of marketing and communications. And here you'll see that we've got this B theme. So be involved, our listening and acting, which is our formal engagement structures, your sort of residents' councils, all that kind of stuff, and be well. And that is the overarching sort of umbrella brand for all of our different wellbeing initiatives. So I'm going to just sort of take us through how we came to this, what those initiatives are, and, you know, potentially how I might be able to help anybody here with resources, etc., to maybe look at these kind of things if you're not already doing so for your organisation, or even pinch some of your ideas. So, as I say, it sits within a relatively small team. We have 2 different areas, wellbeing involvement, try and keep those separate to so that we are very much still about the sort of formal regulation, the stuff that we have to do, as opposed to this, which ultimately, I suppose, could be seen as a sort of nice to have. And we've also got the luxury of a resident EDI specialist who sort of feeds and oversees the whole of our offer. So that's you know, we do know that we're quite sort of lucky, and that is a real luxury to have. So wellbeing, before any of our existence changed really with the pandemic, we were thinking sort of why wellbeing, and do we want to be just more than a landlord? And we were keen that we were wanting to follow the NEF model, so the idea of the ingredients, the 5 ways to wellbeing: connect, take notice, keep learning, be active, and give. And I hope that we have sort of stuck to this, and these effectively will follow through in all of our various initiatives and projects that we have today, and that we hope to develop in the future. So we obviously, as an involvement team, were kind of everything ground to a halt at the start of COVID. That being said, as things developed and we realised how residents were still keen to be involved, we then realised that a new way of working, such as this with Zoom, was the way forward, and we've not looked back in terms of that. Residents were just incredibly flexible in the way that they joined us and found new ways to communicate, and actually we found that it reduced a lot of the barriers in terms of travel, etc. We did realise, though, through being in touch with our residents, that they were starting to feel isolated, and we were trying to think of ways to combat the loneliness that they were feeling. So we started off by sort of expanding our digital inclusion offer by Stay Connected. This was a quick and easy way of loaning out tablets to residents across the country so that they could stay in touch with residents, with relatives and families. Coffee mornings, we realised communal areas were shut. We launched a virtual coffee morning. So every Tuesday morning at 11, we'd have people from all over the country logging on or dialing in if they didn't have technology, sharing experiences of, you know, of how they were finding this challenging time. We already had the start of a wellness programme, Be Active, but we decided to really increase the frequency of that and started sort of Joe Wick style live sessions that were Workout Wednesdays as in the first instance, and re-engage our partnership with the befriending service. We just expanded on that and referred people over to them for and colleagues as well, volunteering to act as telephone volunteers. This slide, which you'll see if you sent these over, basically explained sort of the impact in the positive sense of the Stay Connected and where we sent most of the tablets to, and you know, how it improved residents' wellbeing, with 88.4% of them saying who'd borrowed the device, saying that it had, you know, increased their wellbeing. And we were able to get £30,000 of the funding from an Aviva grant we got for digital inclusion, and we're able to purchase these tablets to get them delivered straight out to residents. Here you can just see some of the happy faces of the residents that we helped. I think over 200 of them received tablets over the period, and there's some just really good news stories and anecdotes from people whose lives have been positively affected. I'm going to just, hopefully you'll be able to hear this. This is just a video that was actually made by some location staff showing one of the residents who had impacted positively from borrowing a tablet from us.
All of a sudden I acquired one of these from the management. It was just like being there. It was marvellous. floated for a couple of days. Dioramas in nets. I found I could buy stuff off the internet. Projects now that I'm going to make.
I think you admit, yeah, that's quite powerful, and it was just one of the examples of the impact that it had on our residents' life. So, new branding. So, following sort of coming out the back of the first lockdown, we started to develop some branding for our wellbeing initiatives. So, Be Well, the overarching brand. Be Active, which is our wellbeing and physical movement. Be Digital, which is our digital inclusion. Be Skilled, which is our it's a portal similar to what we offer colleagues, but with lots of online training and actual hard copy training if they want it to expand you know, skills. It could be things that like poetry, it might be things about getting a food hygiene certificate so you're able to set up a social group, you know, huge variety of courses on there. Be Connected, which is our sort of online and postal club and also includes our digital virtual coffee mornings, and Be Wise, which is our financial inclusion offer. Here they all are. So Be Digital, we decided that we were not the best to be necessarily giving out digital training. So our new model for sort of 2022 offers local managers the chance to borrow up to 20 devices, and residents can also borrow them for a sort of finite period. And then we signpost to local services to help build their skills. We're starting a pilot in the Manchester area with a number of devices and local volunteers to be able to measure the impact of this. Our Be Active programme, as I said, this is our real sort of flagship product. We've worked with other housing providers as well to sort of be able to share the best practice that we've got. We have contributors who now do live sessions on a Monday, Wednesday and Thursday, 160 residents sort of roughly over a week join us, and we're also working with the England Walking Football Association to set up a pilot around trying to set up 2 teams of residents across the country on a 10-week programme. Bit more information there on Be Skilled. Again, that's something that we're wanting to develop, and moving forward look at sort of what other types of access we can give to people with sensory impairment to this module. They're just some of the examples of the courses. So as we said, it's things around it might be setting up a group, it might be poetry, it might be things that are more housing related, ASB, as well as you know, sort of nice to have information. Here's just a picky of one of our coffee mornings. As I say, it's just a really good chance for people to come together, not only for a chat now, but also we have a programme of speakers, and we also have a book club that meets on a monthly basis. We've had an author attend with the book, and we always send the book out to our residents as well for the first people that sort of book a place on there. We were able to still run the gardening competition in lockdown, and this is again always gets a tremendous response, and again it's just a way of people being able to either be involved on a local level or in their local community. And our Later Life awards for our residents this year were announced by our Chief Executive, our Wellbeing virtual conference, and as you can see here, we've sort of tweaked them to introduce awards such as COVID Champion and Digital Dynamo. Here are some of our winners and some just amazing good news stories from all of this, and anecdotal evidence of what an impact the wellbeing initiatives have had. We've also, for the 2nd year running, we've got the RSPCA Gold Award, so we're obviously a pet friendly landlord, and we're keen to partner with organisations such as the RSPCA and PDSA to really just champion the benefit of welfare of pets in housing and care. One of our sessions here, this is just showing you our wellbeing fair, and we were able to group everything together in one event to be able to sort of promote and encourage residents who weren't aware of our initiatives to get involved. So very quickly, what's coming up in 2022? We're hoping to launch Be Creative, which is going to be an arts, music, dance type initiative. Our walking football programme starts on the 1st of March. Resident roadshows, we're going to be out there demonstrating and showing residents sort of face to face, hopefully, how all of these things work. With Be Active, we're going to be offering residents sort of an MOT, and as I said before, developing the Be skills. And although we've got lots of great news stories that go with all of this, we are also going to be introducing some impact assessment similar to the ONS sort of happiness survey, so we can really make a sort of statistical evidence on how this has improved our customers' lives, and just the benefits of being just more than a landlord, and the impact on sort of well-being, and how we can help keep our residents healthier for longer. And then just again, some really nice stuff for you to read at another point about the impact this has had on individuals. And that's it. Thank you.
Anna, thanks ever so much. I hope you can hear me. My internet seems to be a bit unstable, but that was really a great overview. You may not be aware, but I know the HousingLIN had a little hand in helping Anchor write its wellbeing strategy some years ago. So what's so pleasing to see from our perspective is how you've taken it forward, not just because of a brand, but actually how you've made it real for customers. And also it echoes a lot what Francis was saying from Orbit's perspective as well. So again, a lot of shared learning there, I think, for all. So thanks ever so. And what I really like how this session has flowed is that we've looked strategically at some of the high level issues, but also taken sort of the messages from Chris and Jill and what you and Francis have done to show how to make them real in terms of delivery frontline services, and critically how to enable residents and your customers to stay safe, stay well, and be connected during the pandemic, and using that as the platform for going on. Thanks ever so. And we've had a few questions come into the chat box, and I'll invite everybody to come back and unmute yourselves so that we can sort of go through those. I think what you've stimulated is a series of considerations, both from thinking technically around different types of lease models, investment streams, as well as thinking about sort of, I think Jill, you sort of talked about health inequalities. Well, I was very struck by that, and perhaps also you'll be familiar with some of the work that Public Health England did, looking at the Jubilee line about how people's health deteriorated every stop beyond Westminster as you went further east. And it sounds like you and others have also sort of done a lot of work understanding those inequalities in your localities. So if I start off with Claire's question, which is right at the end, has just come in, and she specifically asked for Anna, but you, please, everybody, please do respond to this. How do you measure the outcomes of the wellbeing activity?
Yeah, really good question. In the first instance, we have been doing smaller pilot measurements on each of the different initiatives and the impact that that's had. So, for example, with Be Active, we'll have done we'll have got a pilot amount of residents together and sort of measured their well-being at the start and at the end after they'd followed so many sessions through. What we're hoping to do, or what we intend to do, is we're now going to do with the Be Active, we'll be doing some MOTs on all of our participants, and then following a set amount of questions through. But on everybody that takes part in any of the wellbeing initiatives, we'll be surveying them using sort of, as I said, similar questions to the ONS, in order to sort of see how any of these activities could have impacted their happiness and wellbeing. So it is something that we're aware it all looks very good, and we've got the good news and the case studies, and we know that it's making an impact because we're speaking to these people and they're giving us testimonials, you know, without us even asking for them. But in order to be able to really say this is where somebody was at the start and this is where they are now, that's going to be that next stage about implementing those sort of impact assessments to be able to evidence that.
And Chris, I'm aware that you as an organisation have looked at well-being, but also put economic value on that, both in terms of its sort of cost effectiveness for the NHS and some of your work around mental health services. Have you got any other sort of thoughts around outcome measurements?
Yeah, no, you referred to, we've done a couple of reports that have looked at, the economic benefits of supported housing as opposed to the inpatient services. Yeah, they're huge. But I think we have done some other softer pieces of work that look at the quality of life outcomes, if you like, of living in the community. And I mean, we concentrate. It's interesting, isn't it? You concentrate on the economic argument because with government, the economic argument seems to hit home. But really, the really stark comparisons are the quality of life of someone who's been living in a hospital or in a very institutionalized setting, suddenly having their own home and living in a supported housing environment, and to have their family around for a cup of coffee and everything that goes with living in the community that we all experience is just vast. So I think there does need to be more research on that captures a lot of that, actually. But it's the real reason we do it. I think the economic case is just to get the government to listen.
Yeah, well, that's well. Jill, obviously the economic case is critical for you and your elected members as well as your stakeholders. Any thoughts on measuring outcomes and well-being and what you as an adult social care corporate director needs to think about? You touched on some of them in your presentation.
Yeah, absolutely. I mean, I think there's two aspects to well-being, isn't there? There's the mental well-being and then physical well-being. So in terms of physical well-being, first of all, the way we like to measure that generally over the population is healthy years of life expectancy. So it's how long people live, but good quality years where they're in healthy situation. In terms of mental health and well-being, we would look at people's general happiness, so satisfaction with their local area and their social connectivity tends to be the way that we measure mental health and well-being. We also spend a lot of time on looking at the economic case for well-being, and there are some really stark financial imperatives for us as a local authority. So just to give you a really simple example, we've just been doing some work on looking at how we avoid new admissions into our hospital service. And for every healthy person in the county, the average cost to the NHS is about £80 per year. For every person with multiple comorbidities, the average cost to the NHS is at least £8,000 per annum. So the more we can reduce those comorbidities and ill health, permanent ill health and chronic ill health issues, the bigger the positive impact is on the economy generally. And that's just one indicator. The contribution to the economy through work is another contribution that people can make when they're in good quality health. And of course, the cost of social care can be measured in economic terms as well. A domestic care package, for example, might cost us on average £100 a week. A nursing residential care package at the higher end of the scale might cost us £1,500 a week.
Yeah, so there is a vast difference in those in terms of those financial sort of outlays. And Francis, I'm just wondering from your perspective, because obviously you talked about some of the step down intermediate care facilities. So you as an organisation also will have relationships with not just your, I think it's 100-odd authorities you work in, that may be districts, but you have a relationship with adult social care, but also the acute sector as well. So are there types of measurements that your partners are seeking?
I think one of the part of the problem is it's different in every area as well. There's a lack of consistency, which does make life harder. So in terms of sort of some of the general wellbeing work, there's like the main measures that we're using, the Warwick Edinburgh Mental Wellbeing Scale, a number of the different activities. So a good standardised measure that's been well known and used for quite a long period of time. But then looking at each of the other sort of different authorities, there's a different, it is essentially a different set of measures. So it's hard to say sort of which one stands out as either being the best or the easiest to use or delivers what we need. And then also picking up on Chris's point, around sort of some of the economic benefits as well. We've been doing a lot of work using both the HACT and the TOMS models for demonstration of social value, particularly for sort of the support of extra care housing as well, to try and sort of continue to tell the right story about why we need to invest in these kinds of properties as well. And I think there is sort of a need for us all as a sector to work together to sort of share the information, share and agree certain approaches so that we can then put across the best case for investment and ensure that there is the right strategy going forward.
Oh, thanks for that. I mean, you talked about sort of the strategy going forward, and one of the questions that David Black raises is issues around, do we need a nationally agreed measure of poverty? And again, that might be a question for Jill to start off with, around some of those sort of health inequalities that you touched on in your presentation, which I think his underlying concern is not just a postcode lottery, but he who or she who sort of promotes and profiles their locality best might have a bigger say.
Yeah, there's a bit of a bidding war, isn't there, going on at the moment with government, and those people, those organisations or those places that are able to pull together the most compelling cases, and sometimes, you know, if I'm being totally honest, that might mean the glossiest submission and brochure, tend to be the ones that are successful in attracting inward investment. And I think the point I was trying to make is that it's not as simple as just looking at the sort of global issues across the country. We've got to get down into much more of a place-based, granular, community level even, to really draw out some of the big inequalities that exist in our communities. You know, I'm from the northwest of England originally, and one of the most deprived communities in the country. And you know, I understand what it's like to live in that environment, but equally in Buckinghamshire, I see some of the biggest gaps in terms of equalities that I've ever seen in my life, you know, from the extreme wealth on the one hand to the extreme poverty on the other. And because those people living in extreme poverty are low in numbers relatively to other parts of the country, they quite often get ignored. And I think that's the point I'm trying to make. So whatever the measure is for poverty across the country, it has to make sure that we don't leave people behind.
Yeah, no, that's a great point. And I remember the former director of adult social care for Islington talking about how the health inequalities in that borough council in London, every person who moved out was either replaced by somebody who's even wealthier or even poorer. So again, that sort of, yeah, some real dichotomy there. We've had a series of questions about inward investment, and I just want to touch on a couple. So we've got one from Nigel Holmes and one from Kim. And I think Paul Patterson sort of touches on issues around investment. Just the thought about, you know, looking at different inward investment models. So Nigel sort of touches on real estate investment trust, and Kim draws attention to the NHS England capital programme for transforming care programme for, I think that's specifically for learning disability and autism services. So Chris, do you want to sort of kick off, because you talked about the important role of Homes for England, or Homes England?
The REIT model is an interesting one. That is very, for those who are aware of that, your real estate investment trust, and it's private money, isn't it? It's been invested, but it has provided quite a lot of very new, good quality care across the country, but it's very contentious, I think, because it's stacked up on extremely high rents and it's busting all the ceilings, it's exempt accommodation. And I think there's some real questions from regulators and elsewhere about how sustainable it is. So, you know, I don't think we've seen any high profile failures yet, but the model for those, you know, is basically the risk is passed on from the investors to the providers of that housing and the leases, and there's some serious risks about how sustainable that is. I would question that, but the REITs would challenge me if I did and say, well, look, come and see what's being delivered. But I don't think it's the long-term answer. I think we do need to have, you know, we do need to have a proper strategy, because I think a strategy, both nationally and locally, you start to look at, it's a bit like Jill was just saying, we need to look at, you know, it's not about the best organised areas. They're the quickest off the mark to get the money. They organise themselves. They're generally already in a good space. I'm thinking about the 300 million that's coming via for supported housing for the social white paper. I've been on a couple of presentations with the Department of Health and Social Care have talked about how it's going to be, you know, it's people going to have to form partnerships, but those who form the partnerships are those who are already quite organised and are able to do that, and those areas that are not could miss the boat. So I think that's why we need a strategy. We need to look at what's needed in different geographies. We need to look at the demand. We need to look at the supply. We need to look at local demographics, and then we need to see, and funding needs to be then linked to that. So that's a big issue. What was the second part of that question? It was the REITs, and it was also the...
Well, it was about the exempt rent levels and stuff as well. So I think you've touched on it, but
yeah.
I think Nigel was sort of hinting at, you know, is this a popular model? And I think you sort of touched on that the regulator has some issues around it.
Yeah,
as
they
well.
have to. The second area was the transforming care pot. So
the second question was about the transforming care money.
This is the other issue with supported housing. You know, you can get it from, if you're looking around with it, you can get it from, if you're a registered housing association, you can pick it up via HousingLIN. But if you're not, you can't. Then there is another pot available from the Department of Health for the transforming care. That has a whole different set of rules attached to it. Some organisations don't want to take it. And this, again, is in a strategic vacuum, and these things should be connected up. And that's why I think local government and the NHS England and Homes for England should be agreeing a national supported housing strategy, and it should flow down. It shouldn't just be Homes England. And because a lot of associations can provide that housing, but they won't be able to run it. There's lots of other non-profit agencies that can step into that space and work as partners with them to deliver that. But I think, again, that just shows how we've got lots of different pies, lots of different sources. You know, you do deals, you find out where that funding is, which, okay, it works and it's great, but it's not very strategic and it's not fair. There's no, you know, it's not done on a proper strategic basis, if you like.
Yeah, that's helpful, because I think, Jill, you touched on some of this about your role in terms of integrating, you know, and trying to integrate and build those partnerships. Any thoughts about that inward investment that might help stimulate that? And do we need an integrated capital pot? And I'll come to Frances and Anna after that.
From my perspective, it's getting incredibly complex to weave our way through the system now, because if I'm being honest, we are at the moment being inundated with offers from various sources to start to develop within our area, you know, ranging from private equity funds to opportunities, you know, even for the local authority to fund its own development. Now that we're unitary, to look at public supported investment funds, housing association funding schemes, etc., etc. So it starts to get really complex to really understand what is the best way to develop, to identify the land opportunities and to develop that land for the benefit of the residents. And it creates a lot of additional work. So I think the more we can simplify that process, the better it is for everybody, quite frankly. Yeah. So yeah, I think, you know, if Homes England can intervene in any way to simplify that process, I think that would be very much welcomed.
Well, Frances and Anna, I'll give you the final words on this one, and I think we'll then draw it to a close. So any thoughts on that, or other points that you want to draw attention to?
Well, certainly I always think with the REIT model is something that we've looked at and have discounted. I think there's so much risk that's passed on to the provider on that, and it's other people who are going to be making the profits out of that, and it feels entirely the wrong way around. So for me, it's about how do we identify where there are the right pieces of land that can be then developed, and what's owned by local authorities, by the NHS, what is that's actually within government control. Because the other issue that we always find is that where there's a great piece of land, I think actually that'd be perfect for supported housing or for older people's housing, is that we get outbid, because it's also great for lots of other people. The private sector will always bid at higher rates than we're going to be able to manage, or the REITs will always be able to do it in a different way. And that's where there is a consistent struggle, actually. So what else is there that can we do around sort of the designation of land, how we can work with planners around that? And again, I think, like Jill said, the simpler that the sources of funding can be, the better. And then we can actually get the right outcomes for people at the end of it, rather than just actually who's got the biggest pot of money.
And thanks for that. Outcomes for people. Anna, do you have any final words on that?
No further comments on the bit, you know, the issues. I think Frances has just made a really good point there about us getting outbid, etc. So I think on the best opportunities. But yeah, no, nothing from me. Just you know, really enjoyed being here. So thank you.
Well, thank you. And on behalf of the HousingLIN, can I thank you all for your excellent contributions? Can I also thank everybody who's posted questions in the Q&A? I'm sorry we haven't been able to touch on everything. Paul, we'll come back to you, I'm sure, on some of the points that you raised. I know you're also thinking about writing a blog for us, so that'll be another opportunity for us to share both your thought leadership, but also have a further discussion. Can I also thank the team behind the scenes at the HousingLIN for helping to put on this session. If you have found this happy hour, if this is your first happy hour, we run a series of these right throughout the year. I think we held 50 odd last year. I mean, it was an exceptional year for us, obviously, but do have a look at our programme. We've got a couple coming up, one looking at the digital advancements and technology that's being applied in Scotland, some really interesting work around the digital platforms and their tech strategy across Scotland. And then in early March, we have a session looking at better life, better endings, looking at end of life care with an extra care with Octavia Housing and St Christopher's Hospice. And if you want to sort of contribute to the HousingLIN, we always are looking for really helpful contributions, both in terms of thought leadership and blogs, but also if you want us to discuss your learning and how we can support you through our consultancy services, do drop us a line. We really hope you can continue to engage with us as well as our partners. And on behalf of the LIN, can I just thank everybody for an excellent session. The recording and the slides and the conversation in the chat box will be shared with everybody ASAP, and please do contact us if you can't access it. Thanks again, and look forward to seeing you at the next happy hour. Cheers.